Hello, my name is Carson Powers, and I will be discussing Dorothy Orems' theory of self-care deficit. Dorothy Orem was born and raised in Baltimore, Maryland in 1914. She received a diploma from Providence Hospital School of Nursing in 1934 and attended Catholic University of America, where she received her bachelor's and her master's degree in nursing education. She served as a director at the Providence Hospital School of Nursing, as well as taught biological sciences and nursing to the many students that attended there. She also served as an assistant professor, associate professor, and acted as dean for the Catholic University of America. Dorothy used her nursing education degree to act as a curriculum consultant for many schools, universities, and colleges. Dorothy published her first book, Nursing: Concepts of Practice, in 1971. In this book, she outlines her theory of self-care deficit. She served as chairperson for the Nursing Development Conference Group, along with the International Orems Society was founded to promote further research and development of her theories in nursing. She was inducted into the American Academy of Nursing and received many prestigious awards from the National League of Nursing and Sigma Theta Tau Nursing Honor Society. The self-care deficit theory highlights the importance of when nursing is or is not needed. Patients need to be informed properly of their healthcare diagnosis in order to maintain or improve their health without the constant help from nurses. There are 5 methods for helping in this theory according to Dorothy: acting for and doing for others, guiding others, supporting others, providing an environment promoting personal development in relation to meet future demands, and teaching one another. An individual can properly provide self-care of themselves if they are aware of their health care problems, needs, limitations, and other care needs. In this pyramid diagram, the main aspects of Dorothy's self-care deficit are shown. For this diagram, I will be using an example of a patient diagnosed with diabetes. In the first step, one must adjust their lifestyle to accommodate their health problem. If an individual is diagnosed with diabetes, then they may need to change or accommodate to a different eating style and physical exercise plan in order to help their condition. Next, one must learn to modify their self-image. Individuals with diabetes may or may not have a different appearance if they have to wear insulin packs or if they are in a state of obesity. They must realize that change has to be made to their self-image in order to see progress. Patients diagnosed with diabetes also have to become aware of the potential problems and risks this disease may bring. Once they understand their disease and their potential problems that it may bring, they need to seek or adhere to medical regimen or advice in order to keep their disease from progressing any further. As they live with the disease and begin to make life changes, the patient needs to maintain their progress and health status in order to keep improving. Maintaining a developmental environment is also very important in that it does not distract the patient from reaching their aspirations and goals through this process. Lastly, promotion of normalcy, prevention hazards, support from family and friends, interaction with others, and basic human needs are all huge aspects in keeping the patient focused, determined, and on track. Dorothy Orem's theory provides many great benefits for both patients, nurses, and future nurses. This theory improves communication between the nurse and patient by allowing both to be on the same level of understanding. It also provides a foundation for further research and education, not only for the patients but for future nurses as well. It provides a basis of what nursing practices will work efficiently and ones that will not work efficiently for the future. It promotes good health habits for the patients, and the patients can develop a sense of independence without the need of having to rely on others. Limitations of the theory include individuals who have mental, physical, or emotional loss that may or may not be able to obtain effective self-care. This may prevent them from accessing the right kind of care that they need. If the patient lacks the knowledge and understanding of their disease, it can cause anger along with frustration and stress. If this theory were to be understood, patients would understand when they would need assistance and develop their own independence. They would have more relief knowing what they are up against. I was very intrigued by all the things I've read about the theory of self-care deficit. It allowed me to ponder things about the nursing field I had never thought of. I believe that being self-informed about your personal needs and care plan promotes better health and wellness in the future. In doing this, the problem can be put to a stop before it begins to decline and become critical. Medical expenses would decrease for the individual, supplies would be more abundant, and overcrowding would decrease as well. Nurses would be able to provide more patient-centered care as well, especially in hospitals whose nurse-to-patient ratio is high. Dorothy Orems' theory made me realize the importance of self-care in the medical field, not just hospital care. This theory aims to improve health and prevention of disease in all individuals. Thank you for allowing me to present to you the theory of self-care deficit by Dorothy Orem.